My name is Jenna Maag. I'm a physical therapist for Northwest Physical Therapy. Our office is over on Allentown Road, a couple blocks away. I've been a PT for a little over 6 years now, and I've been doing dry needling for a little over 2 years now. So I'm originally from Leipzig, and I live outside of Ottawa now, and I graduated from the University of Findlay for my PT school. And I did my training for dry needling through Integrative Dry Needling, I think, which is at the top of your frequently asked questions sheet. I did that up in the Cleveland area is where I went for my training. Conditions it can help treat. Pretty much anywhere that you have pain, it could be beneficial for, especially if it's musculoskeletal. Low back pain, neck pain, hip, shoulder, knee, you name it. Piriformis syndrome, sciatica, cervicogenic headaches are a big one. I've had good results with cervicogenic dizziness as well. If you're having issues with that and other things aren't helping, I have seen good results with dizziness. IT band syndrome, plantar fasciitis, any kind of tendonitis type of issues, it's been really beneficial for. And then TMJ and jaw pain is another one that's kind of unique where maybe some other things haven't helped, but actually putting a needle into those muscles can help get you some good relief. So as far as side effects are concerned, usually pain levels are very mild. It's really normal to have a deep dull ache with the dry needling. If it's sharp stabbing or you get a zinger, it's abnormal. We take the needle right back out, and usually the pain subsides right away. But deep dull ache is normal. Sometimes you'll have muscle soreness afterwards. That's probably my biggest complaint with people is just they feel sore, which is to be expected. You're putting needles into your muscles. So it's just like you kind of worked out and exercised and overdid it. That's kind of the sensation that you get. As far as frequency, I usually will start out with like 1 time a week. I'll see how the person responds, and if there's a positive change, then we kind of see how it goes the next week. We can add additional needles. We can do a little bit deeper needling. We kind of have to feel it out the first couple visits to see how your body responds. You don't know how sore you're going to get until after you actually do it. So usually the first visit, we're talking 10 to 15 needles tops, and then we can build up to there, where I've had patients where I'll do 30 plus needles in a session, and you know, it all just kind of depends on how your body tolerates it. Usually if you don't see any positive improvements within 1 to 3 sessions, I'm not encouraging you to keep trying it. We're talking about other interventions that might be beneficial for you. So you usually will notice an improvement at least in mobility almost immediately, if not within the first couple visits. And then pain-wise, I've seen it, again, almost immediately when they come off the table versus 2-3 sessions tops. So how this all works in coming in and getting treated. So the first time you come in, we need to do an initial evaluation where I can kind of take a look at what you have going on, take a look at your range of motion, take a look at your strength, talk about your pain levels, what hurts, so that way I can set some goals to see how we're progressing, both with what you're telling me and your actual measurements. That's kind of what insurance will care about in the long term, is they need to see numbers improve, not just what the patient is saying. But it's most beneficial when it is in conjunction with other things. Do I have people where we just come in and do dry needling? Yes, but usually the first visit, I'm at least showing them what kind of exercises are good to do on a daily basis to help with mobility or with strength. So the first time you come in, we do the evaluation, and then we can do the dry needling right afterwards as long as it seems appropriate and obviously you're willing to do it and you sign off on it. And then after that, we just kind of play it by ear. We take it week by week to see how you're progressing with it. If after 1 or 2 visits you're like, nah, it's really not doing anything, then we can try other treatment interventions, and that's perfectly fine. I'm not going to make you pay for something that really is not working for you. So, but oftentimes, I mean, if you haven't found relief with other things, it's one thing to consider. The risks that are involved are very minimal. And like I said, it can help in a really short amount of time. So,
how long does it seem to last?
I've had some people where it's 1 or 2 visits and then they don't call me at all. I usually will leave someone's plan of care open for a good 8 to 12 weeks and say, hey, if it doesn't come back, leave well enough alone. If it comes back in a couple weeks or 6 weeks, 8 weeks, call and we'll get you back in. But most of the time, unless it's a really chronic problem that, say you've got a fusion, like a significant fusion in your low back, and you know you've always had issues with it, and you know you're always going to have problems. I have some people on my caseload that'll come in once every 6 to 8 weeks and just kind of manage their symptoms as they need to, or if they have a flare-up, where I can just kind of keep extending the plan of care out. You're paying for it out of pocket, so insurance won't dictate how often you come in for it, which is kind of nice. Treating my right arm, which is my dominant hand, like right now, like that's dull, achy, but I use my hands all day at work, and I did a pretty good workout yesterday, so I'm a little bit sore.
What's the name of the trigger point you're putting that in?
That one's a radial, and then I'm just working along what we call your extensor groove.
So that needle is actually in a little protective sleeve?
It's a guide tube, is what it's called.
So that's what keeps it from flexing?
Yeah. So I have to kind of like move it a little bit with my finger to kind of unlock it, and then I put the guide tube on my skin, and then I take my index finger and I kind of flick it, and then it's in the skin, and then I push it in from there.
You don't feel anything?
I feel it a little bit. Definitely if I move my fingers, I can feel it a little bit more.
Well, how many?
You can use it for any kind of joint pain. So back, hip, knee, shoulder, neck. You can use it for any kind of tendonitis type of issues, headaches, just muscular tightness in general. If you have muscle spasms, piriformis syndrome, sciatica, shin splints, I mean, really any kind of orthopedic diagnosis you can use it for. And any kind of general pain or tightness you can use it for.